Hello friends, today we will discuss another important topic, acute lymphoblastic leukemia in pediatric patient. Case scenario, like 12 years old girl presented with recurrent chest infection and weight loss and back pain and bruise. Overview of the examination is preparation time for 3 minutes. For examination and discussion, 8 minutes allotted, warning bell will be given at 6 minutes and total marks allotted 8. Start with doing greetings, introduce yourself, define your role and responsibility, wash your hand with sanitizer and take all the COVID precautions, ask for the consent for the examination and exposure, make rapport by asking short question, what is your name, who is your favorite sports star, and explain what you are going to do before you start. Look for any dysmorphism, any distress, any dystigmata, measure height, weight, and head circumference, plot them in age and sex appropriate growth chart. Look around the surroundings for any device and any drugs. Then start doing GI system examination, which is consistent with general examination and inspection, palpation, percussion, auscultation. ALL is a cancer of white cell count. White cells in bone marrow specifically affects the type of white cell is called lymphocyte, which are crucial for our body immune system. Incidence, the global incidence is 25% of all childhood cancer below 15 years of age. It could be 3 per 100,000 population. Peak incidence noted between 2 to 5 years, and incident rates may vary between countries. In Europe, it is 30 to 45 million 30 to 45 cases per million children per year, whereas in US it is 35 to 40. There are approximately 790 new cases noted in each year in UK, and in developing country the incidence may be lower, but it is still considered as a significant health concern. What are the causes and risk factors? First, syndrome. Down syndrome, Li-Fraumeni syndrome, neurofibromatosis type 1 may be associated. Few genetic predispositions like chromosomal translocation in Philadelphia chromosome between 9 to 22 associated with adult type of ALL. Deletion and mutation of certain genes, somatic mutations like PAX5, ETV6, exposure to the radiation and certain chemicals, and previous treatment for ALL. What are the symptoms? It could be fatigue, it could be weakness, weight loss, fever, easy bruising, bleeding, bone pain or limping, enlarged lymph nodes, night sweats, sometimes Bell's palsy. Diagnosis can be made by doing blood test, full complete blood count, bone marrow biopsy, and lumbar puncture to rule out CNS complication. Major subtypes of ALL are B cells and T cells ALL. Treatment options, we have chemotherapy, radiation therapy, stem cells transplant. Chemotherapy largely consistent with multi-drug regimen, vincristine, corticosteroids, anthracyclines, and aspergillus. There are 3 phases: induction phase to achieve remission, consolidation for the further elimination of cancer cells, and maintenance phase to prevent relapse. What are the treatment? Newer treatment, targeted therapy, immune therapy, bispecific T cells engagers, less intensive chemotherapy, which is effective in managing relapsed or refractory ALL. There are few prognostic factors you need to know, like Philadelphia chromosome, which is initially considered as a bad prognostic factor. Now it is considered as a good prognostic factor. Minimal residual disease, MRD, if it is high, then there is a high chance of relapse. Age below 1 year and above 15 years associated with worse outcome. If the white cell count initially very high, more than 100,000, there is a high chance of relapse. B cells associated with better prognosis, whereas T cells ALL associated with worse prognosis. And response to initial treatment is very important. Central nervous system involvement or testicular involvement associated with high rate of relapse. And genetic expression profile can predict the outcome of ALL and treatment response. Tumor lysis syndrome is one of the complications of ALL or its management. It is associated with hyperkalemia, may lead to abnormal heart rhythm. Hyperphosphatemia may associated with muscle cramp, itching, and sometimes very dangerous if it is very severe. Hypocalcemia associated with muscle cramp or muscle spasm, seizures, and other problem. Whereas hyperuricemia may lead to kidney stones and kidney damage. What is the treatment? Aggressive intravenous hydration to flush out the excess substances. Medication to lower uric acid level like allopurinol, raspberry H. Managing electrolyte imbalance such as calcium and potassium level. For the ALL treatment, you have to manage the side effect of the treatment as well as you need to provide psychosocial support for the family. You may encounter the question related to vaccinations. It is recommended to give vaccines before starting the chemotherapy. Inactivated vaccines could be given, whereas live vaccines to be avoided. Vaccinations of the family member may provide protective cocoon, and booster shots may be given to relearn the response to certain infection. Conclusion: acute lymphoblastic leukemia is the most common subtype of cancer in children, and early diagnosis and appropriate treatment are crucial role in favorable outcome.